is Carter Campbell, and my question is concerning nurses and their experience with COVID-19. I am interested in whether or not nurses who are just entering the field, like say who have graduated in the last 5 years and are relatively new in being a real life nurse, not just a student, how COVID-19 impacted them and how it could result in the future of their career and stuff like that. And so my focus question today is, if we look at the big picture of a nurse's career, did COVID-19 and all the overcrowding and panic surrounding hospitals that come with the virus help prepare new nurses for stressful and hurtful times ahead, or hurt them and cause anxiety and stress till it's all over? Why or why not? This is a question I will ask to the 2 different nurses I will interview throughout the course of this video. So the first nurse I interviewed is a nurse with a lot of experience in her field. She has been a nurse for the last 25 years. Her name is Miss Lori Baugh, and I will let her introduce herself.
Okay, so I went to nursing school at UTMB in Galveston, so I got a bachelor's degree in nursing. And now I'm a charge nurse and in labor and delivery. So we're what you call couplet nurses. So meaning you take care of the mommy and you take care of the baby.
Thank you. Now, if we do step back and take a big picture, do you believe their COVID-19 was at all beneficial towards preparing nurses for the rest of their career and the things that they might face, or if it was just harmful to them and their stress and their anxiety until it all gets back to normal and things kind of die down again? Back to normal.
Absolutely harmful.
Harmful?
Anxiety. Absolutely. It caused anxiety and stress. It caused severe anxiety and stress for very seasoned nurses.
Yeah, and that's why I wanted to talk to you as well, being a very experienced nurse.
Yeah, so absolutely I think it was harmful.
Okay, thank you. And can you explain why in any kind of detail, or?
So, well, first of all, we've never experienced a pandemic, so that's something completely new. Number 2, that this is a novel virus. We didn't really understand the virus. We're still, even today, over a year later, still learning what exactly, the effects on the body are. Mm-hmm. And so, in the early first 3 to 6 months that this was happening, we were treating people, especially with Casey, in the ICU, we were treating people like if they had severe pneumonia, and we were putting them on vents when actually that was causing some harm,
Mm-hmm.
So it was definitely a learning curve on how do we treat these people. So I think that causes anxiety, the unknown. Okay. And I think one of the things in terms of from the patient's view, maybe not necessarily, well, I guess to the nurse too. I mean, you just don't know when you get it, who is going to get it so severely. So we know this is a risk factor, obesity, smoking, lung disease,
Mm-hmm.
any diabetes. So yeah, we know that. But then you get these outliers, but you're not expecting a 25-year-old to have a sudden heart attack.
No.
And that's what you see with COVID is sometimes you see these 20 and 30-year-olds that should be absolutely healthy, and then they have severe consequences. So those outliers just make you, I think that drives some of the fear that people have with COVID because, or at least it certainly does for me. Because
Thank you once again, Miss Lori. Now let's listen to the interview I had with Capella Campbell.
My name is Capella Campbell. I went to Texas Tech Nursing School and started as an ICU nurse in Austin, Texas.
Thank you, Capella. Now, do you believe that COVID-19 and the overcrowding and panicking surrounding hospitals, do you believe that that has helped prepare nurses for stressful and hard times that they will face in their career? Or has it just caused anxiety and stress until it's all over and we can go back to normal?
I think that the COVID pandemic has made nurses burnt out and stressed and will actually make nurses leave the field. I think people aren't going to be able to keep doing this. And the hospitals are exhausted from their resources and everything's a big mess. And travel nursing has become a thing, and I think it will make nurses' careers become shorter.
Thank you, Capella. Now, as we have heard from both of the nurses I have interviewed, Miss Lori and Capella, both do believe that this pandemic has in fact been harmful and has just caused vast amounts of stress and anxiety and really hasn't given any benefit in terms of experience or that aspect to overcome, as it's, as Miss Lori stated, it was a brand new pandemic that nobody had ever dealt with before. They knew the nurses from Capella and Miss Lori didn't know what to do at first. It was a learning curve, I believe, as one of them put it. It's causing them to look for other jobs and other options, as Capella stated, causing them to want to not be nurses anymore, really, and all that stress and anxiety that just comes together caused by COVID-19. As well as the testimony from the nurses I have interviewed. According to research on the internet, according to the American Nurses Association, they report 51% of nurses are overwhelmed, 93% report being stressed more than normally, and 76% report being exhausted and burnt out from their jobs. And a vast majority of the nurses around the United States have reported stress and anxiety coming not from the stress of caring for their patients and what it takes to provide that care and from the training they're given, but as well as the higher fear of being infected corresponding with their job and how close they are, and the stress of possibly infecting someone else and being responsible for that or becoming infected themselves if they have a family or not. And in conclusion, I do feel that the COVID-19 virus has hurt and just caused anxiety and stress to the nurses in America, especially the young ones coming out just starting off their careers. Thank you for listening.